It would eliminate some of the stigma. It will make people more likely to get treated.
Researchers at Northwestern University have developed a blood test that could one day diagnose depression in adults. Welcome back, everyone. I'm Beth Haynes. Nearly 40,000 Americans committed suicide in 2010. The American Foundation for Suicide Prevention believes an untreated mental illness like depression contributed to most of those deaths. Researchers hope their new blood test can change those statistics. Joining us now is Dr. John Kupfner, a psychiatrist with Peninsula Outpatient Centers. Really appreciate you being with us. And
thank you for having me.
This is pretty exciting. It's a blood test that could allow doctors to diagnose depression as easily as they check cholesterol. So let's begin by talking about how this test would work.
Okay, so the way the test works is they took a bunch of people that had a clear diagnosable, like major depressive disorder in adults, and they take blood, and inside that they amplify your genes, and they look for which ones happen to be elevated in that group. So they were clearly able to show certain markers that were correlated with folks that are having major depressive disorder.
Very interesting. And researchers say this test could also help doctors determine if patients need to see a therapist and if that therapy is working.
Well, what this group has done, they've also done this study in adolescents, and they've shown something I know as a child psychiatrist, that adolescent depression and adult onset depression are two different illnesses. The markers are very different. So it would also be able to tell us which types of depressions are caused by stress, or which ones are sort of by your genes and genetics, which ones will be more responsive to medications, which ones should be seen by therapy, and then you can recheck and see if you're improving. Is the therapy working, or do you need to do something different? So, I mean, the help this would give us in mental health is sort of infinite.
Yeah, kind of a game changer, right?
It would be a game changer because there's so many different types of depression. It's not, I mean, there's bipolar depression, major depression, then depression caused by stressors or events in your life, and all those things can come into the office the same but look differently. At least in like pneumonia, we can check fever, we can check oxygen saturations. We have nothing to check except for trial and error if you're responding to treatment or not. So this would give us something we could follow to see how well patients are doing.
Almost seems too good to be true. We were just talking about this. Anything that makes you skeptical when you think of a blood test like this?
Well, right now it's in its infancy. I think in my career we will see this. We will be able to use these sorts of markers. This is exactly what happened with SSRIs. They tested the spinal cords of completed suicide victims, and they found lower than normal amounts of serotonin, so that's how they developed those drugs. So new drugs will be developed, new treatments for depression. There's a lot of excitement. The concern I have is what, with any genetic information, who's going to use it, who's going to see it? Will your insurers charge more money if you have these elevated markers, even if you have no symptoms? Will life insurance companies want to test this before they insure you and change your policy price based on these things that you have no control over? So that's the big ethical problem with any of this genetic testing.
Yeah, a lot of questions out there for sure. Still years away from this being in every doctor's office, but talk about the reality that it could lead to more diagnosis of depression.
It can lead to more diagnosis. It can lead us to earlier treatments, interventions, so that people don't remain. Depression costs this country tons of money because you miss work, you're sick more frequently, and everybody knows that. So if we had ways like with cholesterol and heart disease to intervene early and keep the bulk of the illness off, like that could be changing to the whole society, not just to, you know, an individual.
How far away are we from this?
You know, I would guess 5 years before we see this start to show up.
Okay.
It's got to go through the research centers first, and then we would start to see these tests being available. Currently, the latest testing we do in mental health, there's some genetic DNA testing that will tell you how good you're metabolizing all the antidepressants we currently prescribe to help us select one. So there is movement on this. Insurers are paying for that, so I would say at least 5 years.
All right, Dr. John Kupfner, psychiatrist with Peninsula Outpatient Centers. Really appreciate you being with us,
Thank you for having me.
I'm sure we will discuss this much more.